So if any damage occurs in the cerebellum, so depends upon the involvement of the cerebellar structures, so the symptoms will be vary. So if you see the symptoms of the cerebellar injury, so his first one is again is the asthenia. So means will get the muscle weakness. So asthenia will get, and also it will give the muscle weakness. Asynergia, so loss of ability to associated with the muscle together for the complex. So is going to be the unable to do the accurate movement, and also is a delayed reaction time. So delayed reactions means the increase the time required to initiate the voluntary movements. For example, if you want to hold something, or if you want to hold something with this object, so who are having a cerebellar injury, it's a difficult to hold this object. So it takes time. They're trying to hold the object, but it's a difficult to initiate. The initiation of the movement is going to be is a difficult. So that is because of the delayed reactions. And also another important symptom of the cerebellar injury is the dysarthria. So dysarthria means the difficulty in speech. So cerebellum also is responsible for the speech. So if any damage, so it may use the dysarticulation, the speech is may alter. And also another important function of the symptom is a dysdiadochokinesia. So dysdiadochokinesia means, so is the inability to so that means impair the ability to perform the rapid alternating movements. So they are unable to perform the alternative movements of the hands. So for example, if you ask them to do this is the face downwards and also upwards, or supination and pronation of the hand. So forearm now is the pronation. If you ask them to supinations, who are the normal persons, so they can do the supination and pronations. But if anybody having the cerebellar injury, they are unable to perform the supination and pronations. So this symptom, this sign is called as dysdiadochokinesia. So or otherwise, if you ask them to do like a tapping of the toes up and down, if they ask them to tap the ankle up and down, so unable to perform the movement. So this is the classical sign of the cerebellar injury. And also next one is the dysmetria. In dysmetria means inability to judge the distance from the distance judge or distance or the range of movement. For example, the dysmetria inability to judge the distance. So for example, if if any like a object is the task oriented thing, if you ask them to touch these things, if the normal person can touch directly here, so who are having this dysmetria symptoms, so they don't know how much the distance between the finger and also task the thing, so unable to reach the object properly. So this is a difficult this the difficulties in the who are having the cerebellar injury. So that is called as the dysmetria. And also the gait pattern, the gait abnormalities are going to be ataxic pattern. So they are unable to walk properly, or unsteady gait, or drunken pattern walking gait. So that means who are the drunken, like did anybody take any excessive amount of alcohol, how they are going to walk, the person also going to be walk in the abnormal posture. If they stand or if they walk, so they are going to be with a wide base support. If they take the narrow base support, so they cannot maintain the balance properly and may chance to get the fall down. So these are the symptoms we can find, signs we can find who are having the cerebellar injury. So coming to the another signs and symptoms is the hypotonia. The muscle tone is going to be decreased. So one of the major function of the cerebellum is controlling the skeletal muscle tone. So if anybody loss of the injury, or if any injury to the anterior lobe or posterior lobe, so it will give the muscle abnormalities such as the decreasing the muscle tone, also called as flaccidity. Next one is a hypermetria. Hypermetria means the overestimation of the distance. So and dysmetria and also hypermetria. Dysmetria means the inability to judge the distance. Here is going to be the hypermetria. In the hypermetria, if the task is the near here, but if you ask them the patient, they are going to over the distance. So here already the task is there. They are going to cross the object. So that is called as the hypermetria. And also may chance to get the hypometria. So if the object is here, so they're unable to reach up to a distance, they're going to find out where the object is there. So this is called as the hypometria. So another symptom is called as the nystagmus. So nystagmus means is a quick and also rapid rhythmic oscillatory movements of the eyeballs. So for example, if you ask them to look at the object, so they cannot concentrate on the object. So it's going to be the eyeballs are going to be moved upwards and side to side, cannot concentrate in one place. So this condition, this symptom is called as the nystagmus. So most commonly seen in the who are having the cerebellar injury. So another symptom is the rebound phenomena. Rebound phenomena means, so it's a inability to halt the forceful movement after the resistor stimulus removed. So that means, if for example, if you want to check the rebound symptoms, if the normal person, if you give any resistance to any movement, for example, if I try to give the resistance to my elbow flexion, I'm giving the resistance with my left hand. So I'm giving the resistance to my right hand elbow flexions. So I'm giving the elbow bending. So I'm giving the resistance with my left hand. So if I remove the left hand resistance, so I can control my hand movement. So because of I'm the normal person, so I have the coordination, so I can control my movement. But in case of the cerebellar injury, so who are having the difficulty in the coordinations, if we give the resistance, if we remove the resistance, so they are unable to control the movements. So if we take out the resistance, remove the resistance, automatically they are going to slap their face. So because of unable to control the movements. So this sign is called the rebound phenomena. So while assessing the patient also, again, we have to do this assessment because of we have to know the what are the like a specific signs for the coordinations. So during the assessment also we have to do this one. So these are the symptoms. If you understand about the abnormalities about the cerebellum, so we have to assess thoroughly during the assessment of the patients. According to the signs and symptoms, we have to give the training properly. So another symptom of the cerebellar injury is going to be the titubations. So titubation means is a rhythmic oscillation of the head and also axial movement of the trunk. So titubation means, so in case of the, for example, right cerebellar hemisphere damage, so the titubation is going to the right side. So they are going to get the rhythmic oscillation of the head. So they are going to do they always do the shaking movements. So this shaking movement is called as the titubations. So in case of the any head injuries or in case of the any like a chronic injuries, or if anybody is if anybody fallen history of the fall from the heights or maybe sudden like jerky movements. So if any injury occurs in the cerebellar regions or any micro trauma, any like a decrease of blood circulation in the cerebellum, it may chance to get the titubations. So those people, so they are going to give the oscillatory movements. So it's nothing but the head is going to give the shaking and also shivering movement. How the tremors is going to give the rest, like a movement. Same thing in the head is going to give the oscillatory movements. So which is also called as the titubations. And also another symptom of the cerebellar injury is the tremors. So just now we discussed some tremors are nothing but it's also oscillatory movements resulting from the alternative contraction of the opposing muscles. So this is also going to be the, for example, in the hand tremors, if they want to hold something object, anything object, so if they try to hold, automatically they are going to get the shivering and also shaking. So this movement is called as the tremors. So especially who are having like a neurological injuries and also degenerative diseases, Parkinson disease. So those people are may chance to get the tremors. So these are this called is the involuntary oscillatory movements. So these tremors, different types of the tremors are there. So this is the intentional tremors and also postural tremors. So these intentional tremors are oscillatory movements during the wall is a voluntary actions. So if you want to hold something, so voluntarily if you want to try to do any activities, so automatically they are going to get the shivering movements. So that is called as the intentional tremors. Coming to the postural tremors are going to be these are going to be due to exaggerated oscillatory movements of the body in standing posture or a limb held against the gravity. If they maintain any posture, any static posture is against gravity, they are going to get the abnormal shaking or abnormal involuntary movements. So that is called as the postural tremors. If they try to stand up, if they try to stand, so they are going to get the shivering and the body and the trunks also. These are called as the postural tremors.